Hello, welcome to the TeleVox webinar-focused patient outreach for appointment confirmations. Our goal is to share valuable information from our experience with thousands of dental providers. We strive here at TeleVox to provide tools to our clients that help them engage their patients and customers. Traditionally, we did this through automated phone calls to remind patients of their appointments. But today, our house call system includes support for email and SMS. And our clients have extended its use far beyond appointment reminders. We are calling today's presentation 5 Things You Need to Know, and we'll walk through 5 key facts from our experience as an automated notifications provider. From the perspective of a dental provider who schedules daily appointments for service, a simple form of patient engagement is the appointment reminder. I'm sure that if we polled practices, we'd find that a very large percentage of you could list one or more of the following as a problem in your practice: high cost of postage reminders, high no-show rates, and incorrect patient data. If you have these problems, you are certainly not alone. The problem of lost receivables due to missed appointments is internationally recognized. A study in Britain revealed that an estimated 1.1 million patients fail to show up for appointments per year, or about 3,200 per day, at a loss of over $350 million due to missed appointments in 2008. Though we could not find a direct study source for lost revenue in the U.S., the yearly report produced by the Department of Health and Human Services concerning health in the United States, in conjunction with the CDC and National Center for Health Statistics, estimated there were about 1.1 billion visits to physicians and outpatient facilities in 2007. If you estimate the value of an appointment at $120 and base your estimates on the average practice no-show rate, you can see how missed appointments affect practices in the United States. It's simply staggering. According to Dr. Roger P. Levin, over a 20-year period, practices with a 5% no-show rate will lose up to 1 year of production. Dr. Levin also states practices lose well over 15 workdays per year due to communication issues. This can equal $30,000 to $60,000 or more in lost production. Additionally, tens of thousands of dollars are lost from patients who do not accept treatment. Effective communication could resolve much of this problem. Here at TeleVox, we have seen automation of appointment reminders and related alerts have tremendous impact for practices of all sizes. Today, we'll share with you the top 5 lessons we've learned by serving thousands of practices and top healthcare clients, including many of the U.S. News & World Report honor roll hospitals. Each week, we send approximately 5 million notifications via voice phone calls, email, and mobile text messaging. Oftentimes, we've heard speculation as to whether appointment reminders will actually impact no-show rates. We conducted a survey with about 3,000 practices participating. Of those surveyed, we learned that practices who reported using no appointment reminder strategy at all were much more likely to report no-show rates over 10%. From this study, and from years of experience automating reminders, we take Lesson 1. Appointment reminders can reduce no-shows by as much as 58%. Take Dr. Robert Deaver in Chicago, Illinois as an example. The practice books mostly Medicaid and low-income patients. Before going live with the house call system for appointment reminders, the practice had an extremely high no-show rate. In the just 3 months after going live with house calls, the practice experienced a staggering 58% decrease in their average monthly no-show volume, going from an average of 60 missed appointments per month to 38. The practice also has had a huge time savings since the staff was previously tasked with the responsibility of making those calls. Many potential clients who initially approach us are concerned that automating appointment reminders will create a less personal impression with their patients. We understand where this impression could come from when we consider some of the robotic-sounding voice technologies that have been utilized by phone systems in the past. TeleVox offers a superior quality voice presentation that enhances the patient experience. Consider the perspective of your staff, who are tasked with contacting patients each day. A medium-sized multi-doc practice could see 100 patients a day. That's nearly 5 hours of manual calling activities each day for someone on your staff. The enthusiasm of even your most positive employee would begin to flag halfway through such a task. At TeleVox, we've learned that automated calling has the counterintuitive effect of increasing the patient's sense of personal touch. Here's why. Our systems can support the patient's choice for how they prefer to be contacted, and in their own language. Our calls utilize professionally recorded messages that are upbeat and customized to your practice. This allows for each patient to receive a consistently enthusiastic and positive message. Finally, our systems work while you are home getting ready for the next day. Since our solutions are automated, they can call patients in the early hours of the evening when they are more likely to be available for a call. In our research, we found that manual calling strategies, presumably because they are performed during working hours, reach answering machines 85% of the time. Another valuable lesson we've learned is that our estimates for the amount of time burned by staff who make manual reminder calls is not exaggerated. You can see here a testimonial from one of our clients. Susan told us that a staff member was dedicating their entire day to make calls before they automated. House calls has decreased staff time associated with delivering appointment reminders by 13%. Susan Wilbur, Dr. James Lovell in Sharon, Connecticut. And Dr. Andrea Feather's practice has experienced similar success. House calls has been a tremendous time saver for our practice. We had previously been making manual calls, which was quite time-consuming and expensive. It probably takes less than 2 minutes to make the calls now. Jeff Feather in Chino Hills, California. The third lesson we've learned is that the savings in staff costs with house calls can be significant. In our survey of 3,000 practices, 72% said their staff could be better utilized with tasks that impact daily patient care, rather than sitting on the phone confirming appointments. Carolyn at Mesa Ridge Dental Center in Colorado, a longtime house calls client, saved approximately $100,000 in staff costs the first 3 years of using house calls, stating, "House calls eliminated the need to hire another full-time staff member, and it keeps our front desk team efficient." By implementing house calls, they were able to eliminate the need to hire a full-time staff member. There is still a large number of practices who choose to use reminder cards sent via postal mail. Postal reminders can be effective, but with postal costs on the rise, nearly doubling since the 80s, this channel of delivery is not the most cost-effective. The fourth lesson we've learned is that automated appointment reminders, delivered via voice phone calls, email, and mobile text messaging, are much less expensive and more effective than postal reminders. Doctors Dunn and Savastano in Lake Mary, Florida, reduced staff time and postage costs associated with appointment reminders by $12,500 per year, or about 28%. In addition to the cost savings and increased effectiveness, an automated phone, email, and text reminder solution has the added benefit of enabling you to locate bad numbers and email addresses. Plus, unlike with postal mail, you get instant feedback as to whether your patients were reached and whether they can keep their appointment. So many of the lessons we have learned about automated appointment reminders relate to efficiency, staff time, and cost savings. But often, we have clients with smaller practices. Their appointment volume is lower, and they tend to focus their energy on creating a very personal touch when they interact with patients. Is automation worth it in these situations? We've learned that automation makes sense for practices of all sizes. In our survey of 3,000 practices, both large and small, 72% said their staff could be better utilized in other areas besides making appointment reminder calls. So even in small practices, the need to utilize staff for more impactful patient interactions is recognized. Using automation enables small practices to spend more time with patients and focusing on excellent customer service rather than drudging through manual calling lists. In addition, automation can help you detect bad numbers and get notice of cancellations in advance of appointments. After all, in smaller practices, each missed appointment has a larger impact on revenue proportionally. We hope our presentation of the 5 things you need to know about automating appointment reminders was helpful. At TeleVox, we believe strongly in the values of the dental industry. At the end of the day, it's about providing the best care to your patients. Patients appreciate the reminders, and practices enjoy the benefits. We hope you'll take this information back to your practice and evaluate whether TeleVox can help you.